Hi everyone, my name is Hadi Zafar and welcome to First Aid Explained, where I, as a medical student, try my best to explain in depth every page of the First Aid USMLE Step 1 2021 textbook. In this video, I'll be covering the biochemistry portion, pages 62 to 71. So let's begin. So here on the first page, we have something called as Rett syndrome and Fragile X syndrome. Now, Rett syndrome is a sporadic disorder almost exclusively seen in females, as the affected males die in utero or shortly after birth. And most of the cases are caused by a de novo mutation of the MECP2 on the X chromosome. Now, the symptoms of Rett syndrome usually appear between 1 to 4 years, and there are a total of 4 stages, ranging from the first stage, between 6 to 18 months, stage 2, 1 to 4 months, where you see the most symptoms, stage 3 from 2 to 10 years, and stage 4, 10 years on. And these symptoms are characterized by regression, return in motor, verbal, and cognitive abilities, ataxia or seizures, growth deceleration, and stereotyped hand wringing. It is also noticed that in Rett syndrome, patients usually have prolonged QT syndrome. And the diagnosis for Rett syndrome is the gene test of MECP2. Next, we have Fragile X syndrome, which is X-linked dominant inheritance. So what happens in Fragile X syndrome? Trinucleotide repeats in FMR1 leads to hypermethylation of cysteine residues, leading to decreased expression. Now, Fragile X syndrome is the most common inherited cause of intellectual disability. Now, Down syndrome is the most common genetic cause, but most cases occur sporadically. So Down syndrome is the most common genetic cause, or genetic disorder, whereas Fragile X syndrome is the most common inherited cause of intellectual disability. So this trinucleotide repeat expansion occurs during oogenesis, and pre-mutation, which is 550 to 200 repeats, leads to tremors and ataxia, and primary ovarian insufficiency, whereas field mutation, which is more than 200 repeats, leads to postpubertal macroorchidism, which is enlarged testes, long face with a large jaw, large everted ears, autism, mitral valve prolapse, and hypermobile joints. Now, self-mutilation is really common in Fragile X syndrome, and this can be confused with Lech9 syndrome, which also has self-mutilation. Always remember that in Fragile X syndrome, patients usually have a long face and a large jaw, as well as large everted ears. And again, self-mutilation is quite common in these patients. So like we discussed earlier, Fragile X syndrome is a part of the trinucleotide repeat expansion diseases, and this may show genetic anticipation or disease severity as it increases and age of onset decreases in successive generations. So the longer trinucleotide repeat expansions you have, the more symptoms or disorders you can have. So in Huntington disease, the trinucleotide of CAG repeats, and the mode of inheritance is autosomal dominant. Myotonic dystrophy has a trinucleotide repeat of CTG, again autosomal dominant. So cataracts, toupee, early balding in males, gonadal atrophy in males, reduced fertility in females. So CTG. Fragile X syndrome, CGG, is an X-linked dominant inheritance. And the mnemonic for CGG is chin protruding giant gonads. Frederick ectasia is GAA, which is autosomal recessive. And here's the mnemonic. All right, moving on. Here we have the autosomal trisomies. Now, autosomal trisomies basically mean that these patients have an extra chromosome in their DNA, or actually in their cells. Now, autosomal monosomies basically refers to only having one chromosome, and these are incompatible with life due to high chance of expression of recessive traits for that chromosome. Now we have trisomy 21 or Down syndrome, Edwards syndrome or trisomy 18, and Patau syndrome, which is trisomy 13. We'll go in detail one by one. Starting off with Down syndrome or trisomy 21, the findings are intellectual disability, flat faces, prominent epicampal folds, single palmar crease, which is right here, incurved fifth finger gap between first and second toes, duodenal atresia, Hirschsprung disease, congenital heart disease such as atrial septal defect, brush field spots, whitish spots in the peripheral of the iris, and this is associated with early onset Alzheimer's disease because chromosome 21 also codes for amyloid precursor protein. Now, 95% of cases are due to meiotic non-disjunction, which is most commonly during meiosis 1, whereas there's an increased advanced maternal age from 1 to 1,500 in females less than 20 years to 1 in 225 in females greater than 45 years. Now, 4% of cases are due to unbalanced Robertsonian translocation, most typically between chromosomes 14 and 21. Only 1% of cases are due to post-fertilization mitotic error. Now, the incidence for Down syndrome is 1 out of 700. A really easy way to remember that Down syndrome is trisomy 21 is drinking age is also 21. The most common viable chromosomal disorder and the most common cause of genetic and textual disability. Now, first trimester ultrasound commonly shows increased nucleotranslucency and hypoplastic nasal bone. Markers for Down syndrome are high, up, which are increased ACG and increased inhibin. Now, the 5 A's of Down syndrome, which are really important to know, is that it has advanced maternal age, atresia or duodenal, atrioventricular septal defect, Alzheimer's disease, AML, and AL. Now let's move on to Edwards syndrome, or trisomy 18. And the findings are Prince Edward. Prince is a mnemonic for helping you remember all the findings. P for prominent occiput, R for rocker bottom feet, I for intellectual disability, N for non-disjunction, C for clenched fist with overlapping fingers, as you can see here, E for low set ears, microganthia or small jaw, congenital heart diseases, amphocelophile, or myelomeningocele. Now, death occurs usually by age 1, unfortunately. Now, the incidence is 1 out of 8,000, and to help remember why Edwards syndrome is trisomy 18, election age is also 18. Now, this is the second most common autosomal trisomy resulting in live birth. The most common, again, is Down syndrome. Next, we have Patau syndrome, or trisomy 13, and the findings are severe intellectual disability, rocker bottom feet, microphthalmia, microcephaly, cleft lip or palate, hollow prosencephaly, polydactyly, cutis aplasia, congenital heart disease, and polycystic kidney disease, amphocele, and death usually occurs by 1 age. Now, the incidence is again quite more rare. It's in 1 out of 15,000. And remember, Patau syndrome, P can stand for puberty at age of 13, so trisomy 13. And this is basically a defect in fusion and precordial mesoderm, leading to midline defects. And this is cutis aplasia, which is a bald spot at the center. So like I said earlier, trisomy has an extra chromosome leading to 3 chromosomes in total per cell, whereas monosomy has only 1, so this is why it's incompatible with life. Here in the diagrams, you have the first trimester screening for trisomies and the different levels of beta HCG and PAP-A, and second trimester screening as well. All right. Now we have the genetic disorders by chromosomes. So all of these are very important for us to remember, but the most common and the most ones that might come for your exam is Down syndrome, so trisomy 21, 18 for Edwards syndrome, X for Fragile X and X-linked A-gamma globulinemia, 13 for Patau syndrome, Wilson disease, and retinoblastoma, and 15 for Prader-Willi syndrome, and Angelman syndrome, as well as Marfan syndrome. Again, all of these are very important, but focus on these, and yeah. Next, we have Robertsonian translocation, and this is the chromosome translocation that commonly involves chromosome pairs 21, 22, 13, 14, and 15. So 1, 2, 3, 4, 5. One of the most common types of translocation and occurs when the long arms of the second acrocentric chromosome, so chromosomes with centromeres near their ends, fuse at the centromere at the second short arms are lost, as you can see here. Balanced translocations, where there's no gain or loss of significant genetic material, normally do not cause abnormal phenotypes. Unbalanced translocations, however, which are missing or having extra genes, can result in miscarriage, stillbirth, and chromosomal imbalances, like, for example, Down syndrome and Patau syndrome. The last two syndromes are Cry-du-Chat syndrome, Cry-du-Chat, which means cry of the cat, congenital deletion on the short arm of the chromosome 5. Now, the findings for Cry-du-Chat syndrome are microencephaly, moderate to severe intellectual disability, high-pitched crying, epicanthal folds, and cardiac abnormalities. So, like, for example, ventral septal defect. Williams syndrome is a congenital microdeletion of the long arm of the chromosome number 7. And the deleted region includes the elastin gene. And the findings are distinctive of elephant faces, intellectual disability, hypercalcemia, well-developed verbal skills, extreme friendliness with strangers, cardiovascular problems, so supravalvular aortic stenosis, and renal artery stenosis. Okay. Now, next we have the biochemistry nutrition aspect. So here we'll talk about the essential fatty acids, the vitamins, the fat-soluble, and water-soluble. Now, the essential fatty acids are polyunsaturated fatty acids that cannot be synthesized in the body, that's why they're essential, and must be provided in the diet. Linoleic acid, or omega-6, is metabolized to arachidonic acid, which serves as the precursor to leukotrienes and prostaglandins. Linoleic acid, or omega-3, and its metabolites have cardioprotective and anti-hyperlipidemic effects. So omega-6 and omega-3 are very important, basically essential. Now, the fat-soluble vitamins are A, D, E, K, and absorption dependent on ileum and pancreas. Toxicity most common than for water-soluble vitamins because fat-soluble vitamins accumulate in the fat. Now, malabsorption syndromes with steatorrhea, which is fatty stools, example as in cystic fibrosis and celiac disease, or mineral oil intake can cause fat-soluble vitamin deficiencies. Next, we have water-soluble vitamins, which are the vitamin B's, C, vitamin B having a range of different vitamins. Now, almost all of these water-soluble vitamins wash out easily from the body, except for vitamin B12 and B9, because B12 is stored in the liver for up to 3 to 4 years. B9 is stored for the liver for up to 3 to 4 months. Now, B complex deficiencies often result in dermatitis, glossitis, and diarrhea. Okay. So now we'll dive deeper into vitamin A and vitamin B1. So vitamin A includes retinol, and retinoic acid, and its function is an antioxidant. Also, it's a constituent of visual pigments, retina, essential for normal differentiation of epithelial cells into specialized tissue, pancreatic cells and mucus-secreting cells, and this prevents squamous metaplasia. Now, retinol is vitamin A, so think Retin A, which is a drug used topically for wrinkles and acne. Now, this is found in liver and leafy vegetables. Now, supplementation in vitamin A deficiency, measles patients can improve outcomes. So use oral isotretinoin to treat severe cystic acne. Use all trans-retinoic acid to treat acute promyelocytic leukemia. Now, a deficiency in vitamin A leads to night blindness, dry, scaly skin, and dry eyes, corneal squamous metaplasia, or Bitot spots, which are keratin debris forming appearance in the conjunctiva, you can see here, corneal degeneration, and immunosuppression. Now, if you have an excess of vitamin A, this leads to acute toxicity, which is nausea, vomiting, increased intracranial pressure. This leads to vertigo, blurred vision, and this is acute toxicity. If you have chronic toxicity of vitamin A, you have alopecia, dry skin, for example, scaliness, hepatic toxicity, enlargement, arthralgias, and idiopathic intracranial hypertension. Now, retinol is teratogenic, which can lead to cleft palate and cardiac abnormalities in the fetus. Therefore, a negative pregnancy test and 2 forms of contraception are required before isotretinoin or vitamin A derivative is prescribed. So isotretinoin is teratogenic. Next, we have vitamin B1, also known as thiamine. Now, the function of thiamine, or thiamine pyrophosphate TPP, is a cofactor for several dehydrogenase enzyme reactions. So, for example, they help in branched chain keto acid dehydrogenase, alpha ketoglutarate dehydrogenase, which is in the TCA cycle, pyruvate dehydrogenase links glycolysis to TCA cycle, and transketolase, which is in the HMP shunt. Now, the deficiency is impaired glucose breakdown, leading to an ATP depletion worsened by glucose infusion. Highly aerobic tissues, for example, the brain and heart, are affected first. Now, in patients with chronic alcohol overuse or malnutrition, we give them thiamine before dextrose to decrease the risk of precipitating wernickelencephalopathy. Diagnosis is made by increased in RBC transketolase activity following B1 administrations. So from here, you have to know that when a patient comes to the hospital with chronic alcohol overuse or malnutrition, we give thiamine before we even give dextrose or glucose. This is to decrease the risk of wernickelencephalopathy and Korsakoff syndrome. Now, moving on to the disorders of vitamin B1 deficiencies. First, we have wernickelencephalopathy, which is acute, reversible, life-threatening neurological condition where the symptoms include confusion, ophthalmoplegia, nystagmus, ataxia. Korsakoff syndrome is an amnestic disorder due to chronic alcohol overuse and presents with confabulation, meaning they string different sentences, making it into a story, but it's completely false. They also have personality changes and memory loss, which is unfortunately permanent. Now, Wernicke-Korsakoff syndrome is damage to the medial dorsal nucleus of thalamus and mammillary bodies. And the presentation is a combination of Wernicke-encephalopathy and Korsakoff syndrome. Then we have dry and wet beriberi. Now, dry beriberi is polyneuropathy, leading to symmetric muscle wasting. Whereas wet beriberi is basically the same thing with high output cardiac failure. So you get dilated cardiomyopathy and edema. Next, we have vitamin B2, also called as riboflavin. Now, the function of vitamin B2 is that it's used in cofactors in the redox reactions. For example, in succinate dehydrogenase reaction in the TCA cycle. And the deficiency leads to chiliosis, which is inflammation of the lips and scaling of and fissures of the corners of the mouth, and a magenta tongue, and as well as corneal vascularizations. Now we have vitamin B3, also called as niacin or nicotinic acid. And the function of vitamin B3 is the constituent of NAD or NADP+, also again used in redox reactions and a cofactor by dehydrogenases. And vitamin B3 is also derived from tryptophan. Synthesis requires vitamin B2 and B6, and this is used to treat dyslipidemia, which leads to decreased VLDL and high HDL. Deficiency of vitamin B3 leads to glossitis, which is severe deficiency of vitamin B3 leading to plagyria, which can be caused by Hartnup disease, malignant carcinoid syndrome, which leads to high tryptophan metabolism, leading to high serotonin synthesis, and isoniazid, leading to decreased vitamin B6. Symptoms of vitamin B3 deficiency, Pellagra, are the 3 Ds: diarrhea, dementia, or also hallucinations, and dermatitis. The C3-C4 segments, dermatome, circumferential broad collar rash, as you can see here, are called a K-cell necklace, and hyperpigmentation of sun-exposed limbs, as you can see here as well. Now, Hartnup disease is an autosomal recessive deficiency of neutral amino acid, for example, tryptophan, transporters in the proximal renal tubular cells and enterocytes. This leads to neural amino aciduria and decreased absorption from the gut, leading to decreased tryptophan for conversion to niacin, leading to Pellagra-like symptoms. Now, to fix this disease, treatment with high protein diet and nicotinic acid. Deficiency of vitamin B3 leads to Pellagra, less B3. Now, excess of vitamin B3 leads to facial flushing. Now, this is induced by prostaglandin, not histamine, and can avoid by taking aspirin with niacin, hyperglycemia and hyperuricemia. Next, we have vitamin B5, also called as pantothenic acid. B5 is penta. And the function of vitamin B5 is a component of the coenzyme A, which is a cofactor for acetyl transfers and fatty acid synthase. The deficiency of B5 leads to dermatitis, enteritis, alopecia, and adrenal insufficiency, which may lead to burning sensation of the feet, or burning feet syndrome. Next, we have vitamin B6, also called as pyridoxine. Now, the function of vitamin B6 is conversion to pyridoxal phosphate, or PLP, and a cofactor used in transamination of ALT and AST. Also, it's used in decarboxylation reactions, glycogen phosphorylase, synthesis of glutathione, cystathione, heme, niacin, histamine, and neurotransmitters including serotonin, epinephrine, norepinephrine, dopamine, and GABA. The deficiency of vitamin B6 leads to convulsions, hyperirritability, peripheral neuropathy, deficiency induced by isoniazid and oral contraceptives, sideroblastic anemia, which is due to impaired hemoglobin synthesis and iron access. Next, we have vitamin B7 and B9. Vitamin B7, also called as biotin, and this is a cofactor for carboxylation enzymes, which add one carbon group. Pyruvate carboxylase, acetyl-CoA carboxylase, and as well it functions with propynyl-CoA carboxylase. The deficiency of vitamin B7 is relatively rare. However, it can cause dermatitis, enteritis, alopecia, and this is caused by long-term antibiotic use or excessive ingestion of raw egg whites. Next, we have vitamin B9, also called as folate. Now, the function of folate, or vitamin B9, helps in the formation of the coenzyme for one-carbon transfer methylation reactions. It is important for the synthesis of nitrogenous bases in DNA and RNA. Now, vitamin B9 is found in leafy green vegetables and also produced in the gut flora, absorbed in the jejunum, folate from foliage. Now, a small reserve pool is stored primarily in the liver. Now, deficiency of vitamin B9 or folate leads to macrocytic megaloblastic anemia, hypersegmented polymorphic nuclear cells, PMNs, glossitis, no neurological symptoms, as opposed to vitamin B12 deficiency, which we'll get to in a bit. Labs are increased homocysteine, normal methylmalonic acid levels, seen in chronic alcohol overuse and in pregnancy. Now, the deficiency of vitamin B9 can also be caused by several drugs, for example, phenytoin, sulfonamides, and methotrexate. Supplemental folic acid at least 1 month prior to conception and during early pregnancy lead to decreased risk of neural tube defects. So give vitamin B9 for the 9 months of pregnancy. Okay, next we have vitamin B12. Now this is also called as cobalamin, and this functions as a cofactor for methanoline synthase, which transfers CH3 groups as a methylcobalamin and methylmolamine CoA mutase, and this is very important for DNA synthesis. Now, vitamin B12 is found in animal products and is synthesized only by microorganisms and has a very large reserve pool in the body that lasts for several years and is primarily stored in the liver. And mostly deficiencies are caused by malabsorption. Now, a patient with vitamin B12 deficiency might come up with macrocytic megaloblastic anemia, such as found in B9, with hypersegmented PMNs. Now, paracentesis and subacute combined degeneration, so degeneration of the dorsal columns, lateral and cortical tracts, and spinocerebellar tracts, due to abnormal myelin. This is associated with increased serum homocysteine and methylmalonic acid levels, along with second-degree folate deficiency. This prolonged deficiency of vitamin B12 can lead to irreversible nerve damage. Now again, like we said before, vitamin B12 is likely caused by deficiency. For example, as an enteritis or alkylhydria or bacterial overgrowth or alcohol overuse. Or the lack of an intrinsic factor, for example, in percutaneous anemia or gastric bypass surgery, which is absent of the terminal ileum where vitamin B12 is absorbed. Now, certain drugs, such as metformin, can also lead to vitamin B12 deficiency. And again, vitamin B9 supplementation can mask the hematologic symptoms of vitamin B12 deficiency, but not the neurological symptoms. Okay, next we have vitamin C, also called as ascorbic acid. And this functions as an antioxidant and also facilitates an iron absorption by reducing its Fe2+ state, necessary for hydroxylation of proline and lysine in the collagen synthesis. Also, vitamin C is necessary for dopamine beta hydroxylase, which converts dopamine to Ne. Vitamin C is found in fruits and vegetables. If there's a deficiency in vitamin C, patients can come up with something called as scurvy, which is swollen gums, easy bruising, petechiae, hematorosis, anemia, poor wound healing, perifollicular and subperiosteal hemorrhages, or corkscrew-like hair, and a weakened immune system. Deficiency can be precipitated by tea and toast diet, usually found in sailors back in the 15th and 16th century. Now, excess of vitamin C leads to nausea, vomiting, diarrhea, fatigue, calcium oxalate nephrolithiasis, and can increase iron toxicity in predisposed individuals by increasing dietary iron absorption. Basically, it can worsen hemochromatosis or transfusion-related iron overload. All right. Now we have vitamin D and E. Now, vitamin D, which is either D3 and D2, which was later converted to 25-OHD3, which is a storage form in the liver, and then the activating form of calcitrol in the kidney. Now, D3, or cholesystrol, is from the exposure of the skin, from the stratum basale to the sun, or the ingestion of fish, milk, and plants. Whereas D2, ergocalcitrol, is from the ingestion of plants and fungi and yeast. Now, vitamin D performs a very important function of intestinal absorption of calcium and phosphate, bone mineralization at low levels, and bone resorption at high levels. And this helps with the regulation of PTH, calcium and phosphate, as well as calcitrol feedback inhibits its own production. Now, a deficiency of vitamin D leads to rickets in children, which is the deformity such as genuverum, which is bow legs, seen in this x-ray here, and osteomalacia in adults, which leads to bone pain and muscle weakness, and hypocalcemic tetany. Now, this malabsorption can lead to decreased sun exposure, poor diet, chronic kidney disease, CKD, advanced liver disease. And the main treatment is to give vitamin D. Oral vitamin D is usually given to breastfed infants as well. And darker skin and prematurity predispose to deficiency of vitamin D. Now, excess vitamin D leads to hypercalcemia, hypercalciuria, loss of appetite, and stupor, seen in granulomatous diseases, which leads to an activation of vitamin D by epithelioid macrophages. Next, we have vitamin E, which includes tocopherol and trinucleotide. And the function of vitamin E is an antioxidant and protects RBCs and membranes from free radical damage. Deficiency leads to hemolytic anemia and acanthocytosis, muscle weakness, demyelination of posterior columns, which is a decreased proprioception and vibration sensation, and spinocerebral tract, or ataxia. Now, the neurological presentation of vitamin E may appear similar to vitamin B12 deficiency, but without megaloblastic anemia, hypersegmented neutrophils, or increased serum methylmalonic acid levels. Now, excess of vitamin E leads to a risk of enterocolitis in infants. High-dose supplementation may alter metabolism of vitamin K, enhance anticoagulant effects of warfarin. Okay, in our final page, we'll be discussing vitamin K, zinc, and protein energy malnutrition. Now, in vitamin K, which includes phytomenadione, phycoquinine, phytantoidine, and menaquinine. The function for vitamin K is that it's used as a cofactor for gamma carboxylation of glutamic acid residues for various proteins requiring for blood clotting. And vitamin K is synthesized by the intestinal flora. To keep in mind that vitamin K is for coagulation, necessary for maturation of clotting factors 2, 7, 9, and 10, as well as protein C and S. Warfarin inhibits vitamin K dependent synthesis of these factors and proteins. Now, a deficiency in vitamin K leads to neonatal hemorrhage, which is increased in PT and increased APTT, but abnormal bleeding times. Now, the reason why vitamin K deficiency happens in neonates is that neonates have a sterile intestines and unable to synthesize vitamin K. Like we said before, vitamin K is synthesized by intestinal flora. Now, vitamin K deficiency can also happen in adults if a prolonged use of broad-spectrum antibiotics are used. Now, vitamin K as well as vitamin D are not in breast milk, so breastfed infants don't know about vitamin D and K. So don't know. So D for vitamin D and no for vitamin K. So that's why neonates are given vitamin K injections at birth to prevent hemorrhagic disease of the newborn. Now, vitamin D is given throughout the newborn's first year of life. Next, we have zinc. And the function of zinc is that it's an essential mineral for the activity of more than 100 enzymes, and is important in the formation of zinc fingers, or the transcription factor motif. Deficiency of zinc leads to delayed wound healing, suppressed immunity, male hypogonadism, decreased adult hair, axillary facial pubic hair, dysgeusia, and anosmia, associated with acrodermatitic enteropathica, which as you can see in this picture, which is a defect in intestinal zinc absorption, and may predispose to alcoholic cirrhosis. Now we have protein energy malnutrition, which is divided into two main categories, kwashiorkor and marasmus. Now, kwashiorkor is a protein malnutrition resulting in skin lesions, edema, due to decreased plasma oncogenic pressure, which is due to, again, a low serum albumin, liver malfunction leading to fatty change due to decreased apolipoprotein synthesis and deposition. And a clinical picture is a small child with swollen abdomen, seen in picture A. Now, kwashiorkor results from protein deficient meals, or MEALS. M standing for malnutrition, E for edema, A for anemia, L for liver, fatty liver, S for skin lesions, like hyperkeratosis and dyspigmentation. Now, marasmus is malnutrition not causing edema, and the diet is deficient in calories, but no nutrients are entirely absent. So as you can see here, marasmus results in muscle wasting, seen in this picture. So kwashiorkor score is protein malnutrition, whereas marasmus is malnutrition of deficit in calories. All right. So I think that sums up today's video. Thank you for listening. Thank you for watching, and have a great day.